Now, in the last video, we saw what are different type of plasma cell dyscrasias, what is their classification, and the staging system of multiple myeloma. In this video, we're going to see the clinical aspects. Now, what are the symptoms? Symptoms depend upon the type of defect there. The patient may be asymptomatic, there may be constitutional symptoms, there may be bone pains, pathological fractures with cord compression, recurrent infections, bleeding because of platelet involvement, or immunoglobulin. They may consume the clotting factors, there may be anemia. Hypercalcemia may present at confusion, somnolence, bone pain, constipation, nausea, and thirst. There may be hyperviscosity because of causing malaise, paresthesia, sluggish mentation, and sensory loss. Physical examination may show bone tenderness, there may be pallor, bruises, neurological abnormalities because of spinal compression or entrapment neuropathies, soft tissue masses, hepatosplenomegaly in some patients, cardiac failure if there is amyloid in cardiac tissue. Amyloidosis may be seen in skin as shoulder pad sign, there may be macroglossia, there may be typical skin lesions, and there may be purpura. Then how you investigate these patients. Total serum proteins may be required. We go for serum and urine protein electrophoresis, immunofixation in serum and urine, detection of serum-free light chains in the blood, complete blood count, RFTs, serum electrolytes, corrected calcium, LDH, and beta-2 microglobulin. Multi-parameter flow cytometry using surface and intracellular antigens to characterize, diagnose, and monitor the disease. Bone marrow or soft tissue biopsy may be required in some patients, and appropriate imaging. If the patient has spinal compression, we may need imaging of that like X-rays or an MRI to define the extent of damage. And then treatment. The benign conditions, they generally require observation. Patients who got monoclonal gammopathy of unknown significance, they may be associated neuropathies which are treated as the CIPD is treated. Patients who got asymptomatic or smoldering multiple myeloma, they require only observation and follow-up. Only in high-risk patient, lenalidomide may be used. Patients who got plasmacytoma, the treatment is radiation therapy. But in some patients, surgery and chemotherapies may be required if the radiotherapy is not working. But otherwise, the primary treatment is radiotherapy. And then primary amyloidosis. There may be in primary amyloidosis, subcutaneous daratumumab plus hyaluronidase is used in combination with bertuzumab, cyclophosphamide, and dexamethasone. Then the treatment of affected organ according to the organ involved. For example, if the kidney is involved or if the heart is involved, the treatment is according to the organ failure. And then most of the benign varieties need observation and follow-up. Any signs of degeneration, they warrant treatment. And the next we see multiple myeloma. What to do in multiple myeloma? Patients who are young, newly diagnosed, potential candidates for transplant. You can use DVRD, that is daratumumab, bortezomib, lenalidomide, and dexamethasone. We can also use VRD, that is bortezomib, lenalidomide, or dexamethasone. And then CYBORD, that is cyclophosphamide, bortezomib, and dexamethasone. Patients who are high risk but potential candidates for BMT, we can use DVRD, esatuximab, VRD combination, VTD, PACE combination, and then patients who are newly diagnosed but not candidate for BMT, they are frail people. Daratumumab, lenalidomide, or dexamethasone can be used, and esatuximab, bortezomib, lenalidomide, dexamethasone, patients who are less than 80 years but they are not frail. Lenalidomide, bortezomib, and dexamethasone is another combination which can be used in these patients. And then the stem cell transplant is the treatment option for these patients. Then you have to treat the complications, for example, skeletal abnormalities, hypercalcemia, pathological fracture, spinal cord compression, control of infections, treating the anemia, acute kidney injury if there is there, and amyloid as per the involvement of the organ. And then you've got plasma cell leukemia, which is a very uncommon disorder. You may require intensive chemotherapy, potentially followed by stem cell transplant for eligible patients, and immunotherapy and targeted therapies are other options. So these are the treatment options for patients who got plasma cell dyscrasias.